Ty, you and I live in somewhat rural areas, I would say,
Yeah.
not major metropolitan areas. People might not have the same kind of options that live there
Hmm.
as they do in big cities. If someone,
Right.
comes down with a cancer diagnosis, where should they go? We hear a lot about going to Mexico for
Yeah.
some of these treatments. Uh, where can people go to get, the treatment that they
Yeah.
want, or some, at least options?
Yeah. You could go to Mexico. There's some good clinics and there's some really
Mm-hmm.
bad clinics. So you want to make sure that before you go, that you that you're familiar with the clinics. And
Mm-hmm.
I talk about some of them in the book.
Mm-hmm.
And so that's something that people can do is they could go to Mexico. I know several doctors that do phone consultations. They will work with your doctor back home wherever you live, and they will work remotely, and they'll get the blood work, with the internet now and with email and
Mm-hmm.
scanning and all that, all in the luxury of your own home. It's very feasible to work with a doctor that's across the country. They can read your blood work through emails and work with your doctor to do that. And I know doctors that do that, and they work with them on nutritional protocols and so on. As a matter of fact, I know a Dr. Farley that
Mm-hmm.
you interviewed
Yep.
last year. He was working with a patient. He lives out on the East Coast. He was working with a patient that lived up in Canada, and he was working with their doctor. And he was actually working on a prostate cancer patient, and the doctor had prostate cancer. He had them both on the same protocol and cured them both. So so there's folks that'll work remotely,
Mm-hmm.
and then there's also some good clinics that you can go to that are in the U.S. and you can stay at a hotel close by, and be treated by that doctor there. And I was just talking to a doctor at lunch before I came up here that works here in the L.A. area that's got a clinic, and she uses all biooxidative type therapies and nutritional approach. She's a medical doctor too,
Mm-hmm.
and she's got a clinic here. She has 40 different medical doctors at her clinic that are all treating cancer patients flying, and she treats them there.
Mm-hmm.
So that's an option too. And that's not the only clinic.
How rare is something like that? A medical doctor that treats cancer in a different way.
It's pretty rare, but it's becoming less rare. I was just talking to at the conference here today. I was just talking to a medical doctor that actually I graduated school from Baylor, and he came up and said, "Hey, I graduated from Baylor in '96 or whatever it was." And
Uh-huh.
he's a medical doctor, and he's now stepping outside the box and going, holistic alternative approach to
Mm-hmm.
treating his patients, and it's becoming more prominent, believe it or not. Which is pretty encouraging to me because that's the whole purpose, isn't it?
Mm-hmm.
Spread the word and get people outside the box, get them thinking in a holistic type approach, and a lot of MDs are actually doing that. My roommate from college, he's a medical doctor now. He's a surgeon, orthopedic surgeon in South Texas, and he's now doing a holistic type approach and nutritional approach. 3 years ago, 4 years ago, he told me I was nuts. A couple years ago, not so nuts anymore. And now he's doing the diet that I recommend in the book, and he's dropped 50 pounds, and he said he feels better than he did in college. So hey, maybe there's something to this nutritional thing.